Thank you for the introduction. So I'm glad to be here to present my research work on the topic, local immune responses play a vital role in post-virus clearance from the infected pigs. This research work was a part of my PhD thesis, which I recently finished. I completed that in the Jeonbuk National University in South Korea. So these are the highlights of my presentation. So moving on. So I guess everybody is familiar with the PRRS virus, so I would skip this. Okay. So during my PhD program, actually, in one of my lab meetings, I was discussing with my supervisors, like, we know the PRRS virus gets cleared from the blood by around 28 days, or you can say a month, and it gradually clears from the tissues. But we also know, like, after 14 days, or you can say 10 to 14 days, the PRRS virus starts clearing from the blood of the pig, as has been seen previously. So, but what was interesting was, like, we all know that there is a delayed systemic adaptive response, as it starts usually after 21 days post-infection, and we also know there's delayed virus neutralization antibody response. And previously it has been proved that the NK cell-mediated cytotoxicity is suppressed by PRRS virus. So, and in addition to these, we also have many PRRS virus immune evasion strategies known. So the question was, like, how this virus is cleared within a month, and how does it start, like, just after 10 to 14 days to clear from the blood. So we planned to design one study in which we wanted to investigate the factors that are responsible for the clearance of this virus. So this we did by observing the trend of the host immune responses against PRRS virus infection during disease progression. In this study, actually, we thought of comparing the local immune responses with the systemic, and as well as innate with the adaptive immune responses to find out those factors. So we ordered 100 PRRSV-free pigs. Those were four-week-old pigs. After like 3 days of acclimatization, we infected them with the PRRS type 2 JA142 virus. Out of those 100 pigs, we infected like 75 pigs, and 25 were kept as an uninfected control. On like 5 pigs and 12, 16, 14, 18, and 12 pigs were then necropsied at 3, 10, 21, 28, and 35 days post-infection to check all the immune factors in this acute phase of infection. So to compare local with the systemic, we checked the immune responses in the PBMCs, and the local responses we checked in the samples that we collected from these necropsied pigs from lungs, bowel, and bronchial lymph nodes. The innate and the adaptive response was observed by flow cytometry, by observing the NK cell response in PBMCs, and the respiratory DC macrophage network, the T cell responses, the humoral responses we measured, and the cytokine responses using the Luminex-based immune assays. So the results. We quantified the viremia and the lung viral loads using the qPCR and the microtitration infectivity assay respectively. So here we can clearly see, like, after around like 10 days or 14 days, there is a clear drop in this virus. As already Professor Toby has discussed, like by 28 DPC, we have a drop in this viral load in the blood. And also the infective virus was cleared by 21 DPC. To check the effect of viremia on the growth rate, we also observed the average daily weight gain, which was significantly reduced in the infected pigs. Then we just correlated the viremia of all these pigs with the ADWG, and we could and we could get that the growth rate of the infected pigs was negatively correlated with the viremia. The microscopic lung lesions were scored from 0 to 3 on the basis of no lesions to severe interstitial pneumonia. Here also we could observe that at 10 dpc, which was the mean peak highest viremia stage, we could observe the moderate interstitial pneumonia in the pigs, which was later cleared, which was later resolved to mild pneumonia with the clearance of the virus. Then moving to the humoral response, we observed the anti-PRRSV IgG response based on the basis of a nucleocapsid protein in the ELISA. Here we could see that the antibodies started appearing after 7 dpc. However, the serum virus neutralization antibodies were checked on the mark cells, and they appeared only after 28 dpc. By this stage, the virus was already cleared. So we thought like this has the least effect on the clearance of the virus. Then moving to the innate immunity. As I told you already, this has been proved like the PRRS virus decreases the cytotoxicity. But however, we tried to check the 2 subsets of the NK cells in the infected and the uninfected pigs. Here, the NKP46 positive NK cells, which are NKP46 positive is actually the CD335. Here we could see that with the increase in viremia, there was an increase in the frequencies of the NKP46 positive NK cells, and which later resolved to normal with the clearance of the virus. Then we associated these NK cell subsets, and here we could get the significant positive correlation of the NKP46 positive cells with the viremia, which would suggest like this NK46 positive cell may have some role in the clearance of the virus, though this subset has not been widely studied in the PRRS virus infection yet. However, the NKP46 negative cells did not have any correlation with the virus. Then we also stained the bile cells with CD163 and propidium iodide to check the live and dead CD163 positive cells. We have a 4-color flow cytometry machine. So based on this staining, we got that at highest viremia, there was a significant decrease in the CD163 positive cells, which later resolved with the clearance of the virus. On normalizing these dead cells to the uninfected pigs, we could see significant increase in the dead cells at 10 dpc, which later resolved to normal. So these PRRs, the PRRS virus destroys the CD163 cells. Then, moving on, the PRRS virus, we know it infects the cells of the monocyte macrophage lineage, which form the part of the respiratory DC macrophage network. So, based on the paper from Mason et al. 2016, we stained the bile cells with MHC2 positive and CD163 and CD172. Here we could get 5 subsets which were phenotypically and functionally different. So this subset, which was maximum, was like alveolar macrophages. And these cells are the residual macrophages present in the lungs. Also, we could get the monocyte-driven macrophages, monocyte-driven DCs, conventional DC1 and conventional DC2. It has been reported like the CDC1 helps in induction of Th1 responses, CDC2 it helps in induction of Th2 responses, and monocyte-driven DCs help in the induction of Th17 responses. So on observing the effect of PRRS virus on these cells, we could see that there is a clear significant reduction of MHC2 positive cells in the infected pigs, which later resolved, and also the alveolar macrophages. However, the monocyte-driven macrophages and other antigen-presenting cells increased at peak viremia. So this J142 virus alters the dynamics of the respiratory DC macrophage network by destroying the AMs, while it increases the frequency of the antigen-presenting cells. So to check the transition of the immune response, we also check the adaptive response in the T cells. We gated the interferon gamma producing CD4 positive cells, CD8 negative cells, and also the CD4 negative, CD8 positive cells to check the response of TH1, TH17, and the CTL. Here, to compare the systemic and the local T cell responses, we observed the responses in the PBMCs, lungs, BAL, and the BLN. First, and we also related it with the changes in the viremia. Here we could see clearly the systemic, in the PBMCs, the systemic response was delayed. It increased after 21 days post-infection in all kinds of cells, TH1, CTL, and TH17. However, on checking the local responses, that's the main crux of this presentation, we could observe the early induction of the local of the TH1, CTL, and the TH17 responses at 10 dpc in all those tissues. And interestingly, in BAL and BLN, we could observe the significant induction up to the 35th day post-infection. So these local protective T cell responses actually coincided with the virus clearance. Also, then we observed the regulatory T cell responses. We know the regulatory T cell responses is actually controversial in PRRS virus. Many of the, usually it has been reported that there is an induction in the regulatory T cell response in PRRS virus infection. However, in our study, we could not get any induction. Even many other studies have also reported that there is no induction in the regulatory T cell response. But interestingly, in the BAL cells, we could get the significant decline all over the infection period in the regulatory T cell response. Then also, we checked the cytokine response, and to compare the local and the systemic, we observed in the serum and the BAL the cytokine response of the 7 different cytokines, the pro-inflammatory and anti-inflammatory cytokine. So here, although there was an increase in the antiviral and pro-inflammatory cytokine in serum at 3 days post-infection, but we can see at 10 dpc, which is the highest peak viremia stage, there was a significant decline in the cytokine production in the serum. But in BAL, we can see there was a significant increase in the cytokine production in those both the pro-inflammatory as well as the antiviral cytokines at 10 dpc, which also actually the localized induction of pro-inflammatory cytokine was responsible, was apparent at the peak viremia actually. However, although the Treg response did not increase, but we can see the IL-10 response here, which is the anti-inflammatory response cytokine. We can see that there is a significant increase in this. Maybe this is for the maintaining the homeostasis. So finally, this is the overall temporal sequence of the immunological events during the acute phase after PRRS virus infection. Although we can see here, by around 28 days, the virus was cleared from the blood. But the peripheral T cell responses and the VNA response appeared after 21 days, which was delayed. So we could conclude that in addition to those some innate responses, mostly the local T-cell responses are may be responsible for the clearance of the virus from the pigs. So finally, the summary. So we concluded that the innate and adaptive immune responses work hand in hand to clear the virus from the pigs. The early induction of the disease and the protective T lymphocytes in local lymphoid tissue and lung parenchyma coincided with the clearance of the virus. And finally, the local immune responses were predominantly responsible for the clearance of virus in acute phase of infection as compared to the systemic response. So these are the future work. Actually, there are many questions that arise from this study which need to be performed in the future. So I thank the funding agencies, my supervisors, and my colleagues who helped me in this study. Thank you.
Okay, we have time for maybe one quick question.
So when you measure the frequency of T cell in PBMC as well as in bowel fluid, is that like virus specific or like just total T cell? Because what I see in your graph is that the negative control pigs also have very high frequency of T cell in there. So I'm curious, is that the virus specific or just total T cell?
We actually compared between the uninfected and the infected pigs. These may not be virus specific. We just check the frequencies of the interferon gamma producing T cells. Huh? No. We didn't do we just checked in vivo. Directly we got the PBMCs from the pigs.
Sorry,
Thank you so much.
time, yeah.